It's easy in a business or a government just to respond to what happens every day. But in order to have customer satisfaction or citizen satisfaction, you need to be coming up with new products, new services that delight people and say, wow, good things are going on.
People being able to see their own work in a new light. And that also helps people rededicate themselves to the work.
We understand, and Mayor Fisher's laid it out very clearly, that you sort of innovate to survive is just the truth. The world keeps changing around us. We need to change along with the changing expectations of our citizens and the changing realities that we live within.
So in our case, we knew that we wanted to make a really strong move at recycling, or really decrease our cycle times with our permits and licensing, or do some good work with animal services, exports, whatever it might be. But it was going to be hard to do that with just our daily work focus. So as we started in the administration, I knew we wanted to put in a performance improvement system, and that's where Louisville came from, and the Office for Performance Improvement, this concept of daily work, continuous improvement, and breakthrough work. But I was really searching for the best way to do innovation and breakthrough. And then when Bloomberg Philanthropies announced that they were looking for 5 cities, that was like, okay, we got this. We were looking for it, it became available, and it was the really right policy at the right time. We were the right place, and we've ended up having a tremendous partnership with the Bloomberg team.
We were so fortunate to work with Bloomberg Philanthropies. They did give us a lot of money, $4.6 million, but that was just the beginning. We had access to tremendous resources through Bloomberg Philanthropies. When Mike Bloomberg calls a meeting, really terrific people show up.
We understood early on that we had to make the investment, we had to take some risk, in order to make any progress. So I would say it's been worth it.
We were also one of the first 5 cities with Bloomberg Philanthropies. So it was New Orleans, Chicago, Memphis, Atlanta, and Louisville. And then a playbook was designed on how you roll out innovation in a city. So it gave us a common language and a learning network so we could accelerate improvement. So those were all things I was very familiar with from the private sector, and said, this has a really good chance of working.
I'd say that we were successful in figuring out where we could succeed and making sure that we kept adapting as we learned.
The very nature of innovation is that sometimes it might not work, otherwise it would have already been in place. So I was proud of our team in terms of pushing forward. Sometimes we didn't get the results we wanted, but we learned a lot, and we incorporated those learnings in the next turn of the innovation wheel, until ultimately we got the result that we wanted.
Quite honestly, a lot of people inside don't feel free or motivated to turn everything upside down, because there's a certain amount of fear and anxiety that comes with that. But when you have a safe place and you have people that can, push the status quo and challenge you to think outside the box, show you what's going on in other places, what your colleagues are doing in other cities, and sort of, at least, put the challenge out there to think differently. I think you absolutely have to have an outside force to do that effectively.
Let's improve health of the residents in Louisville. Oh my gosh, where do you start? But that's part of the playbook, is to start to refine that, refine, until you get to initiatives that are something that we could do and we believed would be successful. And so we tackled first the idea of reducing the number of low severity trips to the emergency room or to the hospital by EMS ambulance, by improving the health of some people who had chronic illnesses and maybe weren't taking care of themselves as well as they could. They needed some education, some early interventions so that they didn't end up with a trip to the ER. So we redefined that part of EMS away from transportation to the early stages of healthcare. Maybe redirecting someone to a physician instead of to the emergency room, and sometimes finding alternative transportation. But the more revolutionary things that we did were, for instance, having someone on site at recidivist addresses. So a recidivist address might be a shelter or a senior living facility, where there are a lot of people and a lot of calls.
Generally speaking, a typical rezoning process will take about 8 to 10 months. A minimum, if you're just not losing a day, it takes from intake all the way to the planning commission 140 days. After the streamline process, it took about 92 days now, and that's a reduction of about a third of the process. We did a survey right before the process. It was at about 20% satisfaction. And after the rezoning process, we monitored this for about a year, doing exit survey for about a year, and the data we're looking at, we reversed it, about 20% satisfaction, but then about 80% satisfaction at the very end.
We had an idea of what we need to do. One of the biggest things was food. How could we get food out of the garbage so that we can maximize our recycling rate, our diversion rate, because it's really all about diversion as well as recycling. We looked at what if we got carts for everybody? How can we cart the whole urban service district? We looked at doing a pilot for a couple of routes. That was good. And then after that pilot, we looked at doing a pilot in the central business district as far as food composting. So we had to provide the containers for them to separate their food, and also constant, consistent education to a point where, there was some minor enforcement, but it was always about education. One of the key things to compliance is educating people. It's not always putting down a hammer. Right now, the program, we're collecting 20,000 tons a month. We've gotten the jail on the service as well, about 45 restaurants. And here's the other thing too, we have a Green Fork Award as well with this program. So we wanted not only to ask people to do this, but we want to incentivize the restaurants, and so people can see that this restaurant is participating in the diversion, and it's a huge win for us.
The Bloomberg team was actually instrumental in getting us the RKG vacant and abandoned property study. And what we learned from that study is that you have to concentrate your efforts. If you spread the resources too thin, you'll never see a substantive change. The question then becomes, where? And that is exactly what the data does. It gives us a 10,000-foot view where we can really analyze and hone in on where the greatest potential lies for doing this work. How does the data help us do that? Well, we can then, once we have a basic data platform, we can carve that in a million different ways. We can look at council districts, which is what the Mayor's Strategic Goal focuses on. We can look at zip codes. We can look at neighborhood boundaries and find patterns, look at concentrations, marry that with other developments or catalytic projects that we're working on to say, we're going to prioritize this area, we're going to double down in this area across the board, all of our programs, and know that that's going to support a long-term sort of revitalization strategy. The biggest thing that culminated in was what we call VAPStat, or Vacant and Abandoned Property Statistics. We borrowed from places like Baltimore and New Orleans to create a public forum where we could bring the senior leadership in the same room with constituents and residents as well as staff to lay out the issues, look at all of these various program activities, and then evaluate how we were doing. And in situations where we needed help from an administrative or a policy perspective, we were able to have that FaceTime with the senior leadership in order to incorporate those new approaches or those new policies that we needed to empower us to do better.
I'm delighted the way that they all worked out. We made significant improvements in all 5 of those areas, but we didn't just stop there. We integrated those skills that we learned through the playbook, and then you see that now in many other projects throughout Metro as well.
I think people are more willing to buy in having watched the whole evolution to date. And so again, you have to brace yourself, you've got to make the commitment to do the hard work, but people have actually seen the result. And so they know, that it's possible to get somewhere better, further along than you ever thought you could before.
Just very, very excited and emboldened to now make this part of the work of Metro government. If you look at the work in performance improvement, now performance improvement and innovation are part of the ways that we just work. They're the tools in the tool chest. It's how we work. It's not a new special thing. It's how we get the job done.
What we really want to do is beyond a team, is to have people in various departments think the way that we were taught to think, and to use this playbook in terms of research and testing and experimentation and work planning and implementation.
Well, what's been great about this work, too, is that people from all over the country and say, my gosh, you guys are getting it done in your city. We're saying that's right. I mean, that's what our team is here. We're can-do, we're entrepreneurial. We want to be the best city government in the country. We realize we're not perfect, but we don't ever waver from that goal. You don't have to look any further than to see these foundation grants we're getting, the innovation achievements that we've had, the national awards and recognition that we have as well, to say, you know what, we're making really good progress here. It's progress that most other cities would really be proud to have.